talk about side effects. And we know some of those autoimmune mediated side effects. The most feared one is pneumonitis and also perforated colon type of things. And you got also other sort of autoimmune like diabetes, etc., and endocrine mediated issues. How do you monitor those patients, and what do you tell them so that you can avoid some catastrophic side effects?
Yeah. So I'm glad we're talking about this because it's just such an important point. Because the challenge here is, we got so used to in oncology managing side effects by just stopping the drugs. And that's how we manage side effects for every other drug, basically up until immune therapy.
Sure.
And the challenge is that these side effects often require specific management. So stopping the immune therapy is usually not enough. And we really have to educate our patients, that we really need to know as soon as, something happens or seems out of sorts. My patients will tell you, I'm often quoted, patients know their bodies better than doctors and better than scans. And so we need to know when something is not right. We also try to check in on these patients, we have great nursing staff and support who proactively, also check in with folks as they're able to, because really the key is
How are you doing this? You're just doing remotely, like via telephone
we
call?
are. Telehealth has enabled,
Sure.
not that it's not ideal in every circumstance, but it is a little bit of a silver lining that sometimes we're able to, touch base in between visits with patients. Yeah.
Well, what are you telling your patient to look out for? I mean, I heard various other medical oncologists and they share some of their insight, but what are you telling your patients to pay particular attention to?
When we look at the data, I think the most common, skin and other things are the most common. I
Sure.
tell people that's usually not dangerous, although rarely it can be, but it's usually just annoying. But things like the GI toxicity, in particular the colitis and
Sure.
diarrhea, you mentioned pneumonitis, I would say are, particularly the GI related toxicities are by far and away kind of what drive a lot of the morbidity, when you look at some of our clinical trial data. So we really talk about, abdominal pain, cramping, changes in bowel habits, really anything that is, sort of out of sorts, because as you said, some of the endocrine things can be pretty insidious and just present as fatigue, but can be dangerous, if adrenal insufficiency goes undetected. So it's a pretty high, level of vigilance, especially when someone's just starting off on therapy, because that's often where we see, especially some of the severe side effects come on is kind of early on in the course of therapy. Patients we have little cards, the drugs that they're on, because they may not come to us necessarily. This may happen at urgent care on a weekend, or we may not hear about it right away. So we just want to have a way, that education for other physicians, I think, is key.
What's on that card? Because that's such a good, useful tool, right? I don't see that. I mean, I think this is something that all the patients on those immune therapy should have. Like, what do you put on those cards? Just say, I'm on this drug?
Yep, it talks about the drug, and then it talks about a little bit about immune, mediated adverse events that, like, right, diarrhea from immune therapy is different than diarrhea from chemo,
Yeah.
Things of that nature. And importantly, our contact information. So a patient at Duke, it's our patient, and we're always on call.
No, this is just a great life-saving advice just right off the bat, right? Because I don't think I haven't heard too many other physicians are giving people this card, right? And I'm sure there's other ways to doing it, but this is such a great useful information.